You might complete a 10 kilometers run without any discomfort and feel perfectly healthy, but a dangerous blockage could be silently forming inside your body. How is this possible? Because your biology operates according to its own rules, completely independent of how healthy you feel. The human body adapts so efficiently that it can compensate for blockages up to 90%, maintaining normal blood flow until it can no longer do so. This is why, for about half of men, the first sign of heart disease isn't chest pain or shortness of breath. It's sudden death. In this video, you will understand why even a physically active heart can weaken without warning, how the body hides these inherent threats for years, and what the only reliable method is to detect heart problems before they become life-threatening. The heart is one of nature's most tirelessly working machines, contracting and relaxing approximately 100,000 times a day. However, the heart cannot draw oxygen from the blood on its own. It relies entirely on a specialized system of blood vessels called the coronary arteries for its oxygen supply. These coronary arteries surround the outer surface of the heart like a network of roots nourishing a living tree, supplying oxygen directly to the myocardium. Within this network, one blood vessel plays a particularly important role, the left coronary artery, and specifically its main branch, known as the LAD. If a small collateral branch becomes blocked, the heart can usually compensate. But when the LAD itself becomes blocked, the myocardium it nourishes is quickly cut off from oxygen. Heart cells begin to die within minutes, and the heart's pumping function declines at an alarming rate. And modern research tells us something crucial about how these blockages form. They don't appear overnight, but often develop silently over many years due to the accumulation of insidious lifestyle habits over decades, such as high blood pressure, blood sugar disorders, smoking, chronic stress, and lack of physical activity. This brings us back to the central question: why do blockages form even in people who exercise regularly and seem to be in excellent health? To answer this question correctly, we need to look deeper into the biological nature of arteries. Most people picture them as simple tubes that carry blood. In reality, arteries are living structures that react and adapt constantly to both time and the biochemical environment within the body. A healthy artery is remarkably elastic, capable of gently expanding and contracting with each heartbeat. The inner surface of each artery is lined by a thin, specialized layer of cells called the endothelium. This layer acts as a smooth, friction-free surface, allowing blood to flow unobstructed. When this layer is healthy and intact, neither blood cells nor cholesterol molecules easily adhere to the vessel walls. However, over time, this endothelium is subjected to numerous damaging factors. Prolonged high blood pressure puts constant mechanical stress on the artery walls. High blood sugar disrupts the normal function of endothelial cells at the molecular level. Chemical compounds in cigarette smoke cause widespread inflammation and oxidative damage throughout the vascular system. And even in people who exercise intensely for extended periods, the strong and repetitive force of the rapid blood flow can create tiny lesions along the inner surface of blood vessels. These small lesions don't cause any immediate symptoms, but they silently trigger a chain of important biological events. When the endothelium is damaged, the body triggers a repair response. LDL cholesterol is transported to the site of damage and used as a temporary patching material. Simultaneously, the immune system mobilizes white blood cells to treat the damaged area. During this process, the white blood cells absorb cholesterol particles and transform them into what scientists call foam cells. As this repair cycle repeats over many years, foam cells accumulate in ever-increasing numbers beneath the artery wall. Over time, along with the deposition of calcium and various metabolic byproducts, this growing cluster of cells hardens and aggregates, forming structures called atherosclerotic plaques deep within the artery wall. These plaques reduce the diameter of the blood vessel and cause it to lose its natural elasticity. This entire process is medically known as atherosclerosis, and it occurs without any noticeable symptoms. This is where a serious and widespread misconception emerges, one that provides a false sense of security for many until it's too late. Most people picture atherosclerotic plaques as a buildup of minerals inside a household water pipe. The deposits accumulate gradually, the pipe narrows, the flow weakens, and eventually, the pipe becomes completely blocked. Based on this model, people naturally assume the body will give warnings beforehand, that they will experience chest tightness, shortness of breath, or physical decline before anything serious happens. This reasoning sounds intuitive, but it simply doesn't reflect how human physiology works. When plaque begins to form inside the artery wall, the body's initial response is not to allow the blood vessel to narrow. Instead, the outer wall of the artery gradually expands outward, physically widening to accommodate the growing plaque while keeping the inner lumen open. This compensatory process is called active remodeling in cardiology, and its consequences are serious. Thanks to this adaptability, what seems like a paradox becomes entirely possible. A person can accumulate a large amount of plaque in the artery walls while the lumen of the vessel remains perfectly clear and blood flow is normal. The heart still receives enough oxygen both at rest and during strenuous activity. That person can run 10 kilometers, climb many stairs, and feel perfectly healthy, without chest pain, shortness of breath, or any unusual sensations indicating any underlying problem. But this extraordinary adaptability is a biological double-edged sword. While patients remain completely confident about their health, the atherosclerotic plaques continue to grow and undergo internal structural changes. And this is what current cardiovascular research has revealed. The real danger lies not just in how much the plaque narrows the blood vessel. It lies in the composition and structural integrity of the plaque itself. Plaques rich in cholesterol and inflammatory substances, even if they haven't caused significant narrowing, are still structurally fragile and at a much higher risk of rupture. When an atherosclerotic plaque ruptures, the body reacts immediately by forming a blood clot to seal the tear. This blood clot, created as a protective measure, can completely block the artery within minutes, cutting off the entire blood supply to the heart muscle. This is when a heart attack occurs, and by then, the patient has no chance of detecting any prior warning signs. This explains the alarming medical statistic that about half of men and nearly two-thirds of women experience the first clinical signs of cardiovascular disease during a severe acute event, including sudden cardiac death. Prior to that, they felt perfectly healthy and showed no signs of anything being wrong. Understanding the mechanism of plaque rupture is crucial. These soft plaques function like fluid-filled blisters covered by a thin membrane. If blood pressure spikes during intense physical activity, extreme stress, or even a routine activity like shoveling heavy snow on a cold morning, that thin protective membrane can rupture. When that happens, the contents spill into the bloodstream. The body interprets this as a large open wound, and platelets rush to the site to form a blood clot. This clotting response is exactly what the body needs when you have a skin tear, but if it happens inside a coronary artery, it has catastrophic consequences. Within minutes, the clot will expand until it completely fills the artery, halting blood supply entirely. This is a type 1 heart attack, and it can happen to anyone with unstable soft atherosclerotic plaques, regardless of how healthy or robust they may appear. Furthermore, medicine has also identified a distinct mechanism specifically related to those participating in endurance sports. This mechanism is classified as type 2 myocardial infarction, and it operates very differently. Instead of being related to arterial blockage, it arises from an imbalance between the amount of oxygen the heart muscle needs and the amount of oxygen the circulatory system can supply at a given time. Essentially, the heart needs more oxygen than the blood can supply, even if the coronary arteries are not blocked. This situation can occur in seemingly healthy individuals. During prolonged or extremely intense exercise, a person may not experience any typical chest pain. The signs are often vague and easily overlooked, including unusual fatigue, sudden loss of energy, dizziness, nausea, or vague physical discomfort attributed to dehydration or exhaustion. Meanwhile, a protein called troponin is being released into the bloodstream. Troponin resides in heart muscle cells and only enters circulation when those cells are damaged or destroyed, making it one of the most reliable indicators of actual heart damage. When coronary angiography is performed on these patients, it often shows no complete blockage. The blood vessels may only be partially narrowed, which is sufficient under normal conditions. But when the heart has to work at full capacity, oxygen demand increases dramatically while dehydration, increased heart rate, and electrolyte imbalance simultaneously reduce the efficiency of oxygen delivery. Insufficient oxygen supply leads to a vulnerable area of the heart muscle being deprived of oxygen, and the actual damage occurs through a silent but equally serious pathway. So, with such effective camouflage, is there any real good news? Yes, and that good news comes from the collateral circulation system, a natural backup system that the heart can develop over time. Imagine your main coronary arteries as the main highways. If a blockage develops gradually over many years, the heart can begin building its own network of alternative routes to bypass the blockage. These smaller blood vessels, called collateral vessels, will dilate and multiply to create parallel pathways for blood supply. This helps explain why a 70-year-old might survive a severe heart attack, while a 40-year-old might not. The older person's heart has had years to build those alternative routes. In young people, when a blood vessel is suddenly damaged, the main pathway is closed off without any effective backup systems in place, and the heart muscle dies before any compensatory network can be established. One of the most effective ways to encourage the development of this protective blood vessel is Zone 2 cardio training and high-intensity interval training, HIIT. Training that stimulates new blood vessel growth will expand your biosafety margin, and in a cardiovascular emergency, that margin means more time, which is the only factor that really matters when a major artery is suddenly blocked. However, this is where many dedicated athletes make a serious mistake. The body doesn't distinguish between running a marathon and running away from a real physical threat. It reacts to both by flooding the system with stress hormones. When someone overtrains without adequate recovery, persistently high cortisol levels create chronic vascular inflammation, gradually damaging the very arteries that training is supposed to protect. The heart is an extraordinary organ that has been working nonstop since before you were born. It shouldn't be treated like a machine that demands maximum power every day. Now let's look at the specific chemical factors that contribute to arterial disease, because the bigger picture is far more complex than the simple story of cholesterol that most people are familiar with. When your doctor measures your LDL and HDL levels and says everything is normal, there are still other substances in your blood that standard tests often miss. First is lipoprotein A, or Lp(a). This is a genetically determined particle that acts as a chronic intrinsic irritant targeting the artery wall. Your Lp(a) levels are entirely determined by genes, and neither dietary changes nor exercise can significantly alter them. People with high Lp(a) levels carry a persistent risk factor for arterial damage regardless of how well they manage other factors. Secondly, there's ApoB, an index that measures the actual number of cholesterol-carrying particles in the blood, not simply the cholesterol content. A person might have normal LDL levels, but carry a very high amount of these particles. This difference is important because a larger number of smaller particles will be in more frequent contact with the artery walls and cause more cumulative microdamage than a smaller number of larger particles carrying the same total cholesterol. The third factor is cortisol. Chronic stress, whether from overexertion, work demands, or personal circumstances, causes cortisol levels to rise persistently. Prolonged high cortisol levels act as a constant abrasive force on the artery walls, creating tiny cracks where plaque begins to form. Research consistently shows that people working in high-stress professions have a higher rate of cardiovascular disease, regardless of their fitness level. So what can we actually do with this knowledge? Instead of offering general lifestyle advice, let's consider specific, evidence-based screening tools that can detect developing problems before they reach dangerous levels. Routine blood tests reveal the chemical composition of substances circulating in the bloodstream, but they don't tell you anything about substances adhering to the vessel walls. More accurate information requires more precise tools. First is the CAC index, or coronary artery calcium index. This imaging test takes about 5 minutes and quantifies the amount of calcium buildup in the coronary arteries. Calcium acts as biological scar tissue deposited at sites of previous damage and repair. A score of 0 reflects no detectable calcification. Scores from 1 to 99 indicate mild plaque buildup. Scores from 100 to 399 signal moderate disease requiring medical attention. Scores above 400 indicate a high-risk condition requiring immediate and comprehensive management. However, a limitation of the CAC index is that it only identifies atherosclerotic plaques that have hardened and calcified. The most structurally dangerous plaques are those that are still soft and have not yet accumulated calcium. Detecting these plaques requires CT angiography, a more advanced imaging technique that can visualize soft plaques, revealing unstable, cholesterol-rich structures that have not yet calcified. This technology can identify dangerous arterial conditions years before any symptoms appear, making it the most powerful early warning system available. In terms of training, workouts shouldn't constantly push the body to complete exhaustion. Aiming for around 80% of your maximum cardiovascular capacity will yield significant cardiovascular health benefits without creating an excessive cortisol response that causes vascular inflammation. This is the effective range for stimulating collateral vessel growth and improving cardiovascular function without causing chronic arterial damage. Think about how professional weightlifters approach training. They don't lift maximum weight in every workout. They gradually increase the intensity of their training while allowing adequate rest periods so the body can regenerate and build strength. If a cardiovascular event occurs, time becomes the only crucial factor. Within 20 minutes of a complete arterial blockage, irreversible cellular damage begins to accumulate in the heart muscle. Within 90 minutes, that muscle tissue will transform into permanent scar tissue, no longer capable of pumping blood. That's why accurate symptom recognition is so important. Men often feel intense pressure or pain in the chest along with discomfort radiating down the left arm. Women often experience less obvious signs, including unexplained fatigue, shortness of breath, nausea, or severe indigestion resembling severe acid reflux. When something feels unusual and serious, it should not be ignored. The nervous system often registers physical discomfort before consciousness fully recognizes what is happening. There's another finding that the fitness industry rarely discusses, and it may be one of the most important in this entire debate. Research on the so-called Rosado effect shows that communities where people maintain strong social connections, even while consuming high-fat diets, have significantly lower rates of heart disease than more socially isolated communities that have seemingly healthier habits. Chronic loneliness creates inflammation in the body that has an impact on arteries comparable to smoking about a pack of cigarettes a day. Social connection and meaningful human relationships create a real and measurable protective effect on cardiovascular health that no amount of exercise can replace. For those seeking the most accurate picture of their cardiovascular risk, measuring standard LDL levels is only a limited starting point. ApoB provides a more precise count of atherosclerotic particles in circulation. LP, A, oxidized LDL, and highly sensitive C-reactive protein reveal the internal arterial chemical environment in ways conventional tests cannot, thereby exposing risks that would otherwise be completely hidden. Cardiovascular events in undiagnosed individuals are largely tragic, stemming from a lack of information. The body's extraordinary adaptability, a quality that makes human biology unique, simultaneously suppresses all warning signals until the situation becomes critical. Controlling blood pressure protects artery walls from mechanical damage. Controlling blood sugar reduces chronic inflammation, which accelerates plaque formation. Regular exercise, at appropriate intensity and with adequate recovery time, strengthens the cardiovascular system without overloading it. But above all, personal feelings of good health cannot replace objective medical data. The technology to examine the inside of your arteries is readily available and accessible. Measuring CAC scores, measuring LP, A, and ApoB levels, and understanding what is actually happening inside the artery walls will provide information that simply feeling healthy cannot. The difference between sudden death from heart disease and a long, healthy life often depends on whether a person has access to timely and accurate information to take action. That information is now in your hands. The only question remaining is what you will choose to do with it.